Where is the love? Where is the love?
You're listening to Infidelity Talk with EJ every Saturday on KNUU. Now, here's EJ.
Hi, welcome back, everybody. This is EJ at Infidelity Talk with EJ on 970 KNUU, and thank you, Dr. LaRusch. We've had Dr. LaRusch, a psychiatrist in Las Vegas, Nevada, who's here, and I want to thank you for being in the studio today to help listeners learn the connection. You're welcome. Thanks so much for being here. I wanted them to really understand the connection between positive mental health that we all want and actually strive for, well, most of the time, I guess, and how infidelity disrupts our well-being either by our own choices or by inheriting the vast amount of consequences from this illicit yet passionate situation. Dr. LaRusch, as a physician and psychiatrist, infidelity is really soaring, and traditional therapy, although I certainly do believe in therapy, is just not getting it. It's not working. And I'd like to know your thoughts and how you and your colleagues could make a difference and a better impact. What are your thoughts about why it soars?
Well, I have seen it in my practice increase. A difficult topic. It's a complex, very complicated. There's so many factors and different players, if you will. But I think one thing we can do as a mental health professional, I'm a psychiatrist, and we don't have a lot of time, often because of insurances dictating we have shorter and shorter appointments and see more people, but spending as much time as we can talking to people about how they're doing in their life, how their relationships are, and are they getting their needs met? Are they thinking about going outside their relationship or their marriage to get their needs met? It's very important. Sometimes physicians I hear stories about, patients come to me and saying, I tried to tell my doctor and he was too busy. He just rushed in and rushed out of the room and gave me a few prescriptions. And I hate to see that and hear that, but it happens.
Over and over, too many times. And I have seen that also. And I wondered, as a psychiatrist, what do you think maybe you and your colleagues, I have thought maybe of a workshop for professionals, something maybe for a weekend, a symposium, because to me, and I've been in this for a long period of time, I really understand. When I first started, I think I was one of the first websites out there for facing your reality, and today there are so many sites out there and the internet, and it's just, there's so much information from message boards and forums and places to go and so many internet sites actually advocating having an affair. It's better for your marriage. It will make your marriage stronger, and I doubt any of them have ever had one, but are making money off of people who want that quick fix. I know that infidelity is the stepchild over there, if you will, the orphan. It's not viewed with the same urgency as alcoholism or drug abuse. And what's your take on that, Doctor?
It is often given short shrift, if you will, because of more pressing things like substance abuse or depression. There's pills for depression that the pharmaceutical companies are flooding doctors with, and even on TV and radio you can see commercials. So people are coming in asking for a pill for this. Infidelity is far more complex, and there is no pill. It's very hard to treat. So often doctors or therapists don't like to get into it because it is so tough to resolve.
That's interesting. I hadn't really thought about that to that point, and I've always believed that infidelity is allowed and it's so glib because people can get away with it. We just don't care. Mm-hmm. And we seem to have insatiable appetites and want more. I know on one of the prior shows that I had, we talked about core needs, and I heard you just say that. Because if the core needs of individuals in any relationship are not met, they're going to be met somewhere else because needs need to be met. And men and women are so vastly different. And it's important for us to really appreciate and understand those core needs of one another. And I don't think that's really done enough. And I was just wondering what you thought about as it relates to why infidelity is just not treated. When you say, well, substance abuse or alcoholism or eating disorders, infidelity is just as devastating, ruins just as many lives, so much. I've also seen domestic violence. I've seen murder. I've seen stalking. An interesting film that I just saw was called Obsessed. I don't know how many of you listeners have seen the movie, but it really, again, takes the bite out of the man and really portrays him as not too smart. And yet this is a gentleman who really gave no signs other than just being kind gestures to a woman who was really very ill and absolutely was bent on causing so much destruction. She wanted this man, and she was going to stop at nothing to have him. And I don't want to ruin it for listeners who haven't seen it yet, but I suggest you go see it, because stalking is mild compared to this. And when I saw it, I thought of psychiatry and taking care of this woman. It was a very intriguing movie at best. And I thought about it a lot, and I'd like to take just a moment or two. We often forget that as a doctor, you're a human being. You bleed, you cry, you hurt, you're also in pain, you have joy and happiness, and a lot of times we forget that as people out there. And share a little bit, if you would, about who you are, maybe hobbies, things you like to do, so that people can really understand that there is no shame or embarrassment to pick up a phone and call the psychiatrist.
Thanks, EJ. I would like to, before I talk about myself, go back to your point about
I tend to
infidelity being kind of glibly dealt with as a topic, and it doesn't seem to be that big a deal, as you said. And I think it's got a lot to do with us as a country or as a culture. We're much more tolerant of things than we used to be, even like say a couple hundred years ago. Think of anything, civil rights. I mean, it wasn't tolerated for women to vote, and now women can vote, of course, and that just seems normal to us. They used to have different restrooms and drinking fountains that wasn't tolerated for African American people to use those, and our culture as far as what is